And this is a controversy in which Twitter now seems to be mired in. The social media giant's latest move has sparked a massive storm. Believe it or not, this is what Twitter has done. The Twitter account of a leading US virologist, Dr. Robert Malone, has now been suspended by Twitter. But who is Dr. Robert Malone? Now, Robert Malone happens to be the inventor of the mRNA technology that is being used to vaccinate millions of people around the world. So we're talking about a researcher who has come up with the mRNA technology of making vaccines. But believe it or not, Twitter, in its wisdom, has decided to suspend the account of a scientist who's come up with the mRNA vaccine, and it claims it has done this because he was allegedly spreading misinformation on COVID-19 vaccines. Let that sink in. The person who came up with an mRNA vaccine, his Twitter account has been suspended by Twitter because they claim he was spreading fake news. Now, Dr. Malone had over 500,000 followers on Twitter. He was removed after he shared a video about supposed harmful effects of the Pfizer jab. In a tweet, Dr. Malone has noted that Pfizer's 6-month data shows that its COVID vaccine causes more illness than it prevents. He also has pointed out the flaws in Pfizer's trial, both in design and also in execution. In a video, he explained that the harms feared to be coming from the Pfizer mRNA vaccine for COVID-19. And the big question, of course, is this: what competence has Twitter got to ban a leading scientist and also the inventor of the mRNA technology? And is Twitter's move an attempt to block concerns regarding the safety of vaccines? Did Twitter conduct a fact check before suspending Dr. Malone's account?
I have not seen a single piece of data that supports the need for a third dose. I have seen many countries basing their decision for a third dose on data obtained from a country called Israel. And as you know, Israel signed a pact with the company Pfizer, so they are using the Pfizer vaccine to a larger extent in their country. So the data from Israel has become the norm. Experiments that were done in baboons, so these are monkeys, and these experiments were done exactly what I have described to you. Because we can't do these human challenge experiments in humans, we can afford to do them in baboons. And in baboons, once you treat them with a vaccine and you challenge them, they are protected. To me, from an immunology perspective, from a virology perspective, is clear. And then I have the pharmaceutical companies who are keeping the data about the challenge that was done in animal studies away from us, and they are really pushing the agenda because they're going to make billions and billions of dollars. And I can assure you, if we accept the third dose and people do the third dose, the fourth dose is coming. You can do an antibody titration test, like for hepatitis B as an example. And if your titration capability is very low, then we give you a booster dose. This time around, I am not convinced. I haven't seen any data that convinced me. And I think the timing of it is also very wrong, because we can't convince people to take the 2 doses. And now you want to convince somebody to take a third who's refusing to take 2? It's never going to work. I think people will just rebel against this.
Right, because people who are already frustrated with this idea of green passes, vaccine passports. But there's a bigger issue here. And I think the bigger issue is the fact that, yes, cases are rising right now. But there is no evidence so far that the cases are rising because of people who are unvaccinated. Remember, we know the data shows that vaccines don't prevent the spread of the virus, nor do they prevent the contraction of the virus. But here's some numbers from you. The UK is doing a great job in terms of actually making its data transparent. And one thing that we have found in the last 7 weeks in the UK is that 62% of the people who were hospitalized in the UK from COVID were fully vaccinated. 73% of the people who died from COVID in the last 7 weeks were fully vaccinated.
Today, newly released data suggests mass vaccine rollouts have failed to stop COVID transmission. According to a medical study in The Lancet, the prevalence of the virus is increasing in fully vaccinated people. After examining new infections in Germany, researchers found that the rate of cases among fully vaccinated individuals ages 60 and older has risen from 16.9% in July to 58.9% in October. That's a 42% increase, suggesting that fully vaccinated people are a major source of COVID transmission. Throughout Britain, the number of household contacts exposed to unvaccinated cases, which was 23%, was slightly lower than the number exposed to vaccinated individuals, which was 25%. Furthermore, an outbreak in Israel that infected multiple healthcare workers and patients, as well as their family members, came from a fully vaccinated hospital patient.